Welcome to the BuddyPet podcast, where we talk everything animal health and wellness with our very own vet and head of animal health, Dr. Elsa Rutherford. How are you?
I'm good. How are you? And who's this?
Oh, this is Milo. We'll see how long he sits here. Probably not for very long, because today, if you haven't guessed, we are talking about cats. Hi, Milo.
Hi, Milo.
All right, so we're going to talk about a very, very big thing in cats, which is kidney disease. So how do you know if your cat has kidney disease, and what are the signs of it?
So symptoms of kidney disease, and that's no matter what the cause, they're quite subtle in cats, but weight loss is a really common one if it's more chronic. Cats will often go off their food quite a bit, so just become, we may think they're just being a bit more fussy, but actually that can be them feeling nauseous and not, they'll go up to the food, sniff it, and then sort of walk away. So that can be hard to differentiate from a normal cat. Vomiting comes later when things are more severe. They'll actually start to vomit as well. So those would be the most common signs. So weight loss, going off their food, or your true anorexia, vomiting, and then sometimes diarrhea as well comes later.
Yeah, so it sounds like it's pretty difficult to really know when your cat has kidney disease. So how is kidney disease diagnosed in cats?
Well, you're right. There's a lot of overlapping symptoms. Those symptoms I've just described can happen for lots of other reasons as well. So the first thing that we would do, if we've got suspicion that there's something wrong, would be to do blood samples. So the combination of looking at blood samples and looking at urine will give us a whole heap of information about cats, and it will tell us, have we got kidney disease? How bad is it? And if we do have kidney disease, then we'll start looking at things like blood pressure as well, and doing some more sort of in-depth analysis about protein levels in their urine. There's lots of sort of secondary tests that we would do as well. But most vets can do that, in the clinic, and you'll get the results the same day or the next day.
Oh, wow. Okay, so that's pretty quick in terms of results. So why and how do cats even get kidney disease in the first place?
Well, there's a number of different reasons. In a younger cat, we see kidney disease because cats can get sort of a hereditary polycystic kidneys. It's something that happens in humans. It can definitely happen in cats as well. It's more common in purebred cats, in the pedigree cats. They can get kidney infections. They can get viral diseases that will cause some of the sort of major feline viruses, such as feline leukemia virus and feline immunodeficiency virus, can cause secondary kidney problems. So those can manifest in younger animals. And then there's obviously, unfortunately, tumors are on that list as well. That tends to happen in older animals. But then we see the majority, I guess, of kidney disease, and what most people in the general population think of with cats and kidney disease is that chronic degenerative type of kidney disease. It's just a sort of natural wearing out of the kidneys that we see in cats as they get older. So that's a disease of an older cat, of which there's no specific triggering factor. It seems to just be a degenerative type of disease.
So what happens during kidney disease?
So over time, no matter what has been the initial insult, I guess, the kidneys will initially compensate quite well. They've got quite a good reserve capacity. So in the early stages, you wouldn't notice necessarily any problems if you start to have kidney insufficiency. And even from a veterinary point of view, we don't necessarily see any changes in blood samples or urinalysis until much later in the disease process. But what's happening during that time is a sort of vicious cycle, really, of inflammation. So it's sort of inflammation within the sort of really intricate networks of tubules that you find in the kidneys. Those become inflamed, and eventually they become non-functional. So you're putting all the pressure on the functional ones that are left, and over time they gradually reduce in numbers. So it's really most often an inflammatory basis for that degeneration.
So can this kidney disease be reversed at all?
Not reversed per se. It can be slow. Well, it depends on the cause. So if there's a specific cause, if we're talking about an infection, then yeah, definitely it can be potentially reversed. Or if we've had a toxin, so things like lilies are really toxic to cats and they'll cause acute kidney damage. And if treated early and adequately, then that can be completely reversed. So yes, in that circumstance, we can reverse it. But if we're talking about that chronic kidney disease that we see in older cats, then we can't really reverse those changes. It's all about trying to slow down that process.
How about curing kidney disease? Can kidney disease be cured at all?
So same thing really. If there is a specific underlying cause for that kidney disease, so if there's an infection, a bacterial infection that we can treat, then yes, you can cure it. Likewise, if if it's a toxic cause and we treat that adequately, it can be completely cured and they may never have a kidney problem again. Whereas that sort of aging kidney change, that chronic kidney disease that we see in older cats, it can't be cured. That unfortunately is a progressive disease.
So we talked about how difficult it is to actually see if your cat has kidney disease just because is your cat just being a cat or it doesn't have kidney disease. So if your cat does have kidney disease, like, will they suffer? Is it painful for them?
Again, it depends on the cause. So infections can be really painful in the initial stages, and then they can be what we would call silent. So initially they may have pain for a few days and then nothing. Same, unfortunately, with some of the cancers that we see. Sometimes they can be painful, whereas the chronic degenerative kidney disease isn't painful. It causes more nausea and discomfort in that sense, but not pain.
So in terms of kidney disease, is it rapid or is it kind of more throughout their entire life?
Again, depends on the cause. So we see, there's acute toxicities where a cat's eaten something they shouldn't do. Things like, as I said, lilies, paracetamol is another one we occasionally see. Cats usually aren't silly enough to eat things they shouldn't do, but sometimes they do. And those acute kidney diseases, by nature of the name, are acute. They'll be fine one day and then not the next. Whereas the chronic kidney disease tends to be a much more insidious onset. So especially if you're seeing your cat every day, you don't notice those subtle signs of weight loss.
Yeah.
Often it's only picked up a year later. Let's say you take them for an annual health check at your vet and the vet says, he's lost a kilo since last year, and a kilo in a 5 or 6 kilo cat is a significant percentage of body weight. So that's often when these things are picked up.
So you hear the expression that cats have 9 lives, but in terms of the one life they do live, if they do have kidney disease, what's the average lifespan for a cat with kidney disease?
If we're talking chronic kidney disease from the point where it's diagnosed, if we've adequately supported that cat and looked at some ways that we can help them, then you're talking often around a couple of years from the point of diagnosis. But it really is very, very variable. And again, if there's another underlying cause, that time frame could be much shorter. And on the flip side of that, some cats will be diagnosed with kidney disease at age 7 or 8, and then they never progress significantly from there, and it's actually something else that that causes them to pass away in the end, and nothing to do with their kidney disease.
Yeah. So how can you help a cat with kidney disease?
Well, the mainstay of helping them is actually through dietary manipulation and supplements. So it's adequate dietary intake of certain things. Now, the kidneys are responsible for filtering waste products. That's one of their main jobs. Water balance is another really important thing, and the way they help retain water, and by nature of that, that's also helping to regulate blood pressure. So blood pressure regulation is really important. Filtering waste products, and then one of the other major things is they are responsible for developing the hormone that stimulates red blood cell production, so stopping anemia. So when we're looking at ways to support these cats, we're looking at, have they got any problems associated with these? So if they've got a buildup of waste products, then we aim to change the diets that we reduce the amount of work the kidneys have to do, reduce the amount of waste that is produced. And the way we do that is by having a much higher quality protein of a moderate level, so slightly restricted, but higher quality protein. So then the waste product from that food is a lot less. Secondly, we need to control the salt levels. So we're not ending up with trying to reduce the chance of having a high blood pressure. Those would be the mainstays of, of dietary changes. And then from an inflammatory point of view, there's some evidence, and it's still in the fairly early days, but there is some evidence to say that omega-3 fatty acid supplementation helps to reduce the inflammatory process that goes on in chronic kidney disease and may help slow that process down. So reducing the inflammation in the kidneys may help slow that process down.
So piggybacking off the omega-3s and the inflammation, how do you go about treating kidney disease in cats?
So first of all, change their diet to, as we say, to just help reduce the salt content, restrict to a certain degree the dietary protein, supplement with the omega-3 fatty acids. So in cats, that means often means a degree of fish oil supplementation can be of benefit. And then monitoring things like blood pressure. And we may need some drug therapy to reduce blood pressure if it's got to a dangerous level.
Yeah, so fish oil, perfect, leads us right into our next question. Is fish oil good for cats with kidney disease? Will it help?
Yeah, so certainly there's some evidence that supplementation of the omega-3 fatty acids in a ratio of sort of approximately 3:1 to the omega-6 fatty acids has been shown to help reduce inflammation in the kidney tubules. And for cats, their metabolism is a little bit different to dogs. So they do need to source some of those omega-3 fatty acids from like an animal source. And the most common one would be fish oil. So fish oils can definitely help to reduce the inflammation in the kidneys and therefore may help to slow down that progression of kidney disease.
So let's talk diet for a second here. What should you be feeding a cat with kidney disease?
So you've got a couple of choices. If you've been told that your cat has kidney disease, we definitely need to look at changing their diet, because a lot of the commercial diets that you buy perhaps from the supermarket, they're really quite high in salt content, and they make the kidneys kind of work harder, I guess, to get rid of some of the waste byproducts of that diet. So often it means a complete change in diet, whether that's to another commercial prescription diet or whether you choose to go down the route of like a home cooked diet, that's your choice. There's lots of good commercial products available that are designed for kidney disease. If you go down the route of a home cooked diet, then you need to make sure it's completely nutritionally balanced. Otherwise, you're doing your cat no favors if it's not balanced over the long run.
Yeah, absolutely. I mean, I could get around cooking for my cat, I'm sure he'd like it too if I cooked him the right things. So now let's jump right into cat UTIs. Can UTIs cause kidney disease?
Definitely. So a urinary tract infection, if it gets out of control for any reason, can go upwards, and it can go up to the kidneys. So obviously the kidneys are connected to the bladder via the tubes called ureters. And infection can track up from the bladder into the kidneys and cause a kidney infection. So it's really important that that we're aware of that, because if your cat has had a UTI at some point and then mysteriously develops kidney issues not long after, then the two things could be linked.
Yeah. So what causes a UTI in cats?
There's many reasons. It's not sort of always straightforward in cats. Often there are underlying reasons why they get it in the first place. So the body has lots of natural defenses to tackle bacterial invasion. One of them being that the concentration of the urine is it's really concentrated, and it's the pH of the urine is slightly acidic, and those two things will be natural kind of barriers to stopping infection. So in diseases where, for example, kidney disease, if a cat already has kidney disease, they'll naturally produce a lot more dilute urine, and so they don't have the same natural defenses against bacteria. So a cat that has pre-existing kidney disease is more likely to get a UTI. Same with things like diabetes and sometimes thyroid disease. So these other underlying diseases make a cat more likely to get an infection. The other major reason that we see UTIs in cats would be often stress related. So stress in cats, and there's all sorts of reasons that they might get stressed. That's a whole other topic, but stress in cats is really common and hard to recognize. And the stress is thought to cause changes in the bladder mucosa that make it more likely to get infected. And more likely to develop crystals in the urine or bladder stones that then make that cat susceptible to getting infections on top of those existing conditions. So, so infections on their own are not that common. There's usually another underlying reason that that cat has got the infection in the first place.
So obviously the best course of action would be talk to your vet if you think your cat may have a UTI, but are there things that you can watch out for at home that like the normal everyday person you can say, you know, maybe my cat has a UTI?
Yeah, look, a cat that has a normal immune system that doesn't have any other underlying health issues can potentially get rid of that infection on their own. So if you're seeing symptoms for less than 24 hours, and then they go away, then potentially that cat has had the ability to get rid of that. You see people supplementing cats with things like cranberry juice or cranberry supplements, as with people. And again, getting unusual things into cats can be quite difficult in the first place. And whether or not it helps, the jury is still out to a little bit, because remember always that these kind of treatments are, most of the time, they're aimed at humans, and that doesn't always correlate with what's going to work with animals, particularly cats, because cats are an alien species. They have completely different metabolic pathways, and things that work in humans and dogs don't always work in cats. So there's not always a huge amount you can do at home, other than look at ways to reduce stress. If your cat gets recurrent UTIs, obviously a vet check is needed, but from a home environment point of view, looking at ways to reduce stress. One of the common things we do see that causes stress in cats that people aren't necessarily aware of is if they've got multiple cats in the household, those cats may be interacting in a way that's causing one of them stress. And you may not notice. You may think it's just them playing, or you may just really not notice those subtle signs. And the other common thing would be if you have like renovation work or someone new coming into the house, that can really stress a cat out, any upset in their routine. And even for an indoor cat, seeing an animal outside of their environment. So an indoor cat is used to, they've got their territory, they're used to that territory, but if they sit at a window or a door and they see a dog outside or another cat outside, that can cause a huge degree of stress, because that cat thinks its territory is being encroached upon.
Funny you mentioned that. Milo, who you met at the start, he is very much an indoor only cat, just living in a major city. But there's a cockatoo that comes to visit and stands on the porch and just taunts him to death. Poor guy. He's finally getting used to it. At first, you could see he was really stressed, but now I think he kind of enjoys the interaction with the bird. So how would you go about treating a UTI?
The number one thing really is to have that cat checked at a vet. So a UTI, if it's the first time we see a cat for a UTI, we would certainly have a look at the urine, see if there's evidence of infection, and then treat appropriately with antibiotics if they're needed. If it's a second or a third time a cat has a urinary infection, we would always advise culturing the urine, which means taking a sample and sending it off to a lab to try and grow the bacteria and make sure we haven't got a resistant bacteria, because sometimes bacteria can become resistant to certain antibiotics, and then we're just treating without really knowing whether it's working or not. The final thing is, from a point of view of investigations, making sure, as we said, that there's no other underlying cause. So we might be doing ultrasound scans to make sure there's no bladder stone, that there's no other underlying issue. And from a natural point of view, looking at diet, making sure that animals got a balanced diet, and sometimes increasing supplementation of essential fatty acids in their diet can help reducing inflammation as well.
So you briefly touched on UTIs will go away by themselves. Would you just kind of elaborate a bit more on like why that happens, or like if that's more often than not what happens?
Look, it's something that I think, yeah, sometimes we don't always recognize the signs, especially if it comes and goes quite quickly in cats. But the majority of UTIs will cause a degree of discomfort and pain for the cat. So you might see them, if they're an indoor cat, going in and out the litter tray quite frequently, or producing a little bit less urine each time they're going. Be aware that in male cats, if they're in and out of the litter tray frequently, there's a high risk that they could be developing a true bladder obstruction, which is potentially life-threatening. So male cats, it's really important that you have them checked and make sure they're not obstructed, that they are actually able to pass urine. Female cats, because of their anatomy, they tend not to get obstructed very frequently, but it can be a painful condition. So the way that they get rid of it is through those natural defenses. So if bacteria try and take hold, the urine, because it's so concentrated, will kill the bacteria that's there. So they may have symptoms for a short period, but then if they go away naturally, you don't need to follow up any treatment.
Great. So in terms of prevention, what can we do to help prevent UTI in cats?
The mainstay is making sure that there's no stress in the environment. That's so important, and I think it's so overlooked by a lot of people, mainly because they're not aware that this is a potential issue. But stress in cats is a huge problem when you have these recurrent urinary issues, and even things like if you've got multiple cats in the household, making sure each cat has access to a fresh litter tray, and because some cats don't want to use the same litter tray as another cat.
Mm.
They can be very fussy, and they don't want to use a litter tray that's already been used once. They might, even if it's all dry, that cat doesn't want to go and use that litter tray because it already smells of another cat's urine. So having clean litter trays, plenty of fresh water access, and reducing stress in cats is really important.
Great. So we all love our little fur babies. How can we make our cat more comfortable that's experiencing a UTI?
So definitely keeping litter trays clean, super important. So, if they're in and out lots, you need to make sure that they've got a clean environment, make sure it's somewhere safe. So again, if you've got toddlers running around, or you've got dogs or anything that might disturb that cat, often having a litter tray somewhere up high where only that cat can get to it is really helpful. Making sure they've got a comfy bed somewhere that they can get away from it all. And cats like to be up high. If they're stressed in any way or they don't feel well, they like to be enclosed and they like to be up high. So a cardboard box somewhere on a countertop is a cat's idea of heaven. They can just curl up in there and not be bothered by the world. So those are the kind of things you can do to help reduce your cat's stress. And then you can look at things like hemp seed oil or CBD oil to help reduce anxieties, help reduce inflammation in the bladder as well. And those are the sort of natural things you can do to support your cat.
So what are some natural remedies for a UTI for your cat?
So natural things that you can do if it's a mild symptoms and your cat's otherwise well. So as long as they're still eating and drinking, then potentially you can try some things at home first. So we're looking at really anti-inflammatory products. So things like essential fatty acids in their diet can help reduce inflammation. And some of the oils, so hemp seed oil is one of them that has this really good balance of omega-3 to omega-6 fatty acids that are good for inflammation. It also has antioxidant properties as well. So these kind of things can help with any kind of inflammatory condition, and that includes urinary issues. Other natural things, a really common one would be turmeric. The active ingredient in that is curcumin, and that has been proven to be a really good anti-inflammatory agent. So the only problem with some of these things is getting them into your cat. So those kind of things, particularly turmeric, it's quite strong smelling, so a lot of cats just don't tolerate it. So really what we turn to is your combination oils. So hemp seed oil and fish oils is a really good combination of essential fatty acids that you can usually get into your cat. The fish oils are usually fishy enough flavoring that most cats will tolerate it. Maybe not all, but if you can get that into your cat, it can really help. So BuddyPet has a product called Luna, which is that combination of fish oils and hemp seed oil, and it's something that you can put on the food, or you can use the dropper and put directly in your cat's mouth. And it's a daily supplementation that will help boost those anti-inflammatory inducing essential fatty acids.
Great. So when are antibiotics necessary to treat a UTI?
Look, so antibiotics, it depends on the type of bacteria involved. Often there's some bacteria that are more that are nastier than others, basically. Some that have more potential to take hold, go up to the kidneys and cause kidney problems as well. So a lot of it revolves around whether this is the first time your cat's ever had a UTI, whether it definitely is a UTI. So people often say a cat has a UTI when actually they've just got cystitis. So cystitis is the symptoms. That just means an inflamed bladder, and the inflamed bladder can happen for a number of reasons. So people often assume that it's a UTI when it's not. UTIs aren't actually as common as people realize in pets. More often, signs of cystitis can be related to stress, can be related to crystals in the urine, which are, again, often come back to stress as well. So you need to know that you definitely have a UTI first before instigating antibiotics. So if you took your cat to the vet, we would always be looking at a urine sample to see, have we got evidence of an actual UTI in here, or do we have what we would call a sterile sterile cystitis, which is where there is no bacterial involvement. So antibiotics, not always necessary. But if you do have a true bacterial infection and it's a particularly nasty type of bacteria, you're not going to get anywhere without them, unfortunately.
Great. Well, that's all for today. Thank you for your time.
You're welcome.